Good afternoon, everyone. My name is Javier Pena. I'm an Implementation Science Manager at RNAO, and it is my pleasure to welcome you to our webinar focused on an intergenerational conversation addressing anti-Black racism. This webinar is an installment in the Let's Talk About Anti-Black Racism and Discrimination in Nursing series. Now, allow me to introduce Dr. Angela Cooper-Brathwaite, immediate past president of RNAO and co-chair of the Black Nurses Task Force. Angela will go over a few Zoom housekeeping details before we get started with today's webinar. We also have Jean Bajnok, RNAO Senior Policy Analyst, here to help this webinar run smoothly and to monitor any questions and comments in the chat.
Thank you, Havina. Good afternoon, everyone, and thank you for joining us today. And today is the 10th webinar in the series of Let's Talk About Anti-Black Racism. And I welcome you wholeheartedly. And I have a few things to share with you. If this is your first time, we welcome you especially. And if you're a returning person, we are so glad you're here and continue to be with us. I do have a few housekeeping tasks, and they are as follows. You can participate with the webinar or in the webinar by typing your questions or comments in the Q&A box or chat box throughout the webinar. Raise your hand if you would like to speak, and we will unmute your line during the question and answer period. So that's following the presentation by our panelists. That's the time you would raise your hand to ask questions, okay? We also have a poll engagement, and this is optional and it's anonymous. Today, the webinar is scheduled to run from 2:30 until 4 p.m. and Dr. Doris Greenspan, our highly esteemed CEO of RNO, will deliver the opening remarks. We will briefly check the pulse on RNO Black Nurses Task Force and then get into our webinar. We're focusing on intergenerational conversation addressing anti-Black racism. We are proud to host two outstanding and amazing speakers who are presenting and going to engage us with a panel discussion. Their names are Nadia Prendergrass and Leanne Pendergrass. There will be an opportunity for question and answer period, and we will close the webinar with updates from RNU. Please allow me to introduce Dr. Doris Greenspan, who will welcome you today and bring a few words this evening. Doris?
Thank you so very much, Dr. Cooper-Brathwaite. You know, every time I go by doctor and she goes by doctor, I think I'm at the Sigma meetings because SCTI always addresses whoever that has a PhD with doctor. And you know what? It's not a bad thing because it takes a lot of time to try to become a doctor and to then become a doctor, which today you will hear from another doctor who is fantastic, Nadia, and then her daughter, who we are trying to convince to become a doctor. Here you go. The more, the better in nursing. It makes it strong. With that, let me bring you greetings coming out of a tremendous, tremendous week in Nursing Week, where we had fantastic events with MPPs, including the Premier Minister of Health, all the opposition leaders, and also two of the leaders of major parties in Canada, in addition to many others. It was truly fantastic. We had also events with resume writing led by Dolores and colleagues. We had awards that we gave to 3 nurses, an RN, an RPN, and an NP. We had so many events. But I cannot move to the next portion without also saying that in the weekend, we suffered 2 big losses. A nurse that is not public yet, an ICU nurse that was a faculty in a college, and that will become public. And she was waiting for her vaccine, and she ended up as a, not as an ICU nurse, but as an ICU patient. So that's very sad, given that finally on Monday, the government announced that nurses will get the second shot. She was even waiting for the first. The second is our own past president, Charlotte Nosgard, who was an amazing, amazing, amazing soul, friend, colleague, leader. So let's dedicate today's event to her memory and to the nurse also that passed away. I know both would be honored that we honor them with that dedication, if you don't mind. And let me pass it back to Dr. Angela Cooper-Brathwaite for remarks, and to also NP, nurse practitioner Corsita, our co-chair, who is amazing, who, by the way, you need to know she's attending today, even though tomorrow is one of the most important days of her life, because one of her kids is getting married. So, well, I say it, Corsita, because not everybody, nurse practitioner Corsita Garaway is so giving that will be spending time with us while is preparing for a beautiful wedding in the midst of COVID, I must say. So thank you for doing that. Back to you, co-chairs.
Thank you, Doris. And at this time, I would like to call back Havina to continue our presentations.
Yes. So just to give everyone a little bit of an update and a background on the Black Nurses Task Force. So in 2020, RNAO launched the Black Nurses Task Force to tackle anti-Black racism within the nursing profession, its organizations, regulatory body, associations, and the broader health system, targeted towards and experienced by Black nurses. There are 17 Black identified RNAO members, including RNs, NPs, and nursing students in the task force, with representation from diverse nursing stages, roles, health sectors, geographic locations, and lived experiences. Our next meeting is scheduled for May 26th, 2021. This webinar series is just one activity of the task force through which we aim to elevate the voices of Black nurses by celebrating their contributions to nursing and healthcare, and to create a safe space to engage in meaningful and critical dialogue around anti-Black racism and discrimination, and raise awareness amongst the broader nursing and healthcare community. We are working towards a final report with key recommendations to our health system partners, wherever nursing students learn and nurses work. In addition, we are working on establishing a repository of resources, specifically with respect to anti-Black racism and discrimination within the nursing profession. So I do encourage you to send anything to me by email address, which will be shared or in the chat, if you would like to add to this repository. Thank you. And the objectives for today include, but are not limited to, provide a deeper awareness of anti-Black racism's impact in the 21st century, begin to bridge the generational gap within nursing through social justice, and identify practical action steps for measurable and transformational outcomes with a millennial lens. Now, I will hand it over to Corsita, the co-chair of the Black Nurses Task Force, to introduce both of our amazing speakers today.
Well, thank you very much for that. And it is my honor to introduce our two fantastic speakers. So Dr. Nadia Prendergrass is a full-time assistant professor at York University, maintains her clinical practice, her clinical skills as a childbirth educator at Mount Sinai Hospital. Being a nurse for over 32 years, she has also worked as a public health nurse, a train-the-trainer, and clinical case coordinator, and has been involved in creating parenting classes and domestic violence awareness programs for health professionals in both England and Canada. After gaining her undergraduate degree in nursing from the UK, she came to Canada, where she completed her master's and PhD at the University of Toronto in higher education and women's studies. Her studies have focused on the lived experiences of internationally educated nurses of color, racism, and gender inequalities, and how these experiences organize themselves within a multicultural framework. Nadia is passionate about intergenerational approaches which spans over 30 years, where she has used her skills in playwriting as an avenue of introducing ancestral and indigenous pedagogies. Thank you. I know the word pedagogies.
No
within
worries.
her teaching and program planning. Our second speaker, which we were going to introduce as well now, is her daughter, Nadia Prendergrass. And Nadia Prendergrass is the president and co-founder of Love Our Lives, a not-for-profit organization which focuses on helping girls and young women live happy and healthy lives. She's also the co-author of a self-help book called Getting to Know Me, which was written because of her personal experience of being bullied as a child. Her book, which was published at age 14, provides support for girls, their families, and other support workers in identifying the telltale signs of bullying. Leanne has an honorary bachelor's degree in Human Rights and Equity Studies from York University. She has a master's in Community and International Development. She's received certifications from the Red Cross Society, Penn Law, Harvard University, the University of Cambridge, and the World Bank. Leanne is a fellow of the Royal Commonwealth Youth Award, Commonwealth, and she's a top 10 recipient of the Under 20 Awards, the Harry Jerome Award for Leadership, and the Attorney General's Victim Services Award for Distinction, the Louise Rousseau WAVE Award, and she's the Leading Woman Building Communities Award, the John Brooks Award, the Future ACES Award, and many others for her work in leadership and community development. Today, Leanne continues to work on programs that help build self-esteem and confidence in girls while providing the necessary tools to shape a future generations of resilient and self-sufficient young women. Her programs use a unique millennial lens and to promote equity and inclusivity within institutional settings. Leanne's work with under-resourced communities also allows her to address the inequities experienced by Black and other racialized groups. Leanne and Nadia.
Thank you so much, Cosita, for introducing our two expert speakers this evening. And before we get them to speak to you, we have a poll. And like I said, this poll is optional. So my first question is, before 2019, was your institution or workplace having discussions on anti-Black racism? Please complete the poll. We'll take a few minutes before the poll is tabulated to give us the results. Okay, we're still awaiting the results. Okay, so 12% said yes, 71% said no, and 16% said somewhat. So not even 50% have discussed anti-racism in the workplace or in the institution. Thank you.
So Angela,
yes,
I think we cannot do it now, but I think after this question next time, we should ask it again. is to ask, are they doing it today? Because imagine if we get the same answer today. You know what I mean? This talks about 2019. Hopefully now it's different with all the, movement that has been put in thanks to George Floyd and to his murder. Hopefully organizations are a bit more, active than what it shows there.
Okay. So thank you, Doris. And the next question, my second question, do you talk about anti-racism with your family? We just wait another minute or so before we get the poll tabulated. Okay, the response, 92% says yes, 5% says no, and 3% says maybe. So people do talk about racism with their family. Okay, my third question is, do you feel comfortable initiating a conversation on racism? The response, 64% said yes, 8% said no, and 27% said maybe. And the fourth question for this afternoon is, where do you get the most of your information about racism from? Is it the classroom, the workplace, social media, or the home? Please select one of those. Okay, the classroom 5%, the workplace 5%, social media or the media 77%, and in the home 12%. Thank you so much for your participation. And now I'll call our first speaker, Dr. Pendergrass, to give her presentation.
Okay, thank you everyone. Thanks so much for the invitation. And also I want to thank in a special way Doris, Angela, Cosita, the team. And as we go forward, we just want to start off by just going into why we do this work, my daughter and I, and what stance we take. So I'm going to be saying next every time because of, I think Anne-Marie will be controlling it. So if you can go to the next slide, Anne-Marie, thank you. So we go under the philosophy of Dr. Martin Luther King, and we feel that especially the time we're living with such tension, it's important to just think, where do we make our stance? And so we love this quote. It says, as my sufferings mounted, I soon realized that there were two ways in which I could respond to my situation. Either to react with bitterness, or seek to transform the suffering into a creative force, We, Leanne and myself, have decided to use the latter. So we're hoping from this session, you're going to gain many informations from this that you can use in your own family life and also in the workplace setting. So let's go to the next slide. So I'm going to start at a very interesting place. I'm talking about the doll experience. So I'm very fortunate to work at a great hospital as well as teach at the same time. And one of the work I do is working in the prenatal class. So you can imagine it's such a lovely place to work. And in my workplace, they try to really promote diversity. And one of the ways they do it is to have all these diverse dolls, many of them. But the interesting thing I have found in working with this, that every time I put a doll out, the black doll stays, is the extra one that is left. Or if I swap the dolls around, so I began to do my own experiment, the black doll was the last one to be received. So this kind of made me think, what was it about the black doll? So one day, however, there's an incident, many, but there was this one that stood out to me. When one of the clients came back from the lunch break quite late and there was a black doll left. He took the black doll for his wife who had just sat down, and he looked at it and he held it precariously and he waved it at the other clients, a couple of clients, and said, oh, it's an ugly doll. And the other woman moved and said, oh yeah, it frightens me. I was an earshot away from what they were saying. And as a nurse, I had to just hold that and not say anything and continue teaching, but it bothered me. And so, next slide. What I began to learn is that this experiment has always been done. It's been done for ages. Next. So it was first done by a couple called the Clark. They were both psychologists, and they felt that the segregation in America, the school segregation, had adverse effects on the lives of Black children. So what they did next is to have two dolls, one black, they were identical twin dolls. One was black, one was white. And when they put them out for people to look at, the children to choose, this is what the children felt. So you can just do next. Okay, so this is what happened. The black doll, everybody rejected, and it was seen as bad, ugly, and undesirable. The white doll, on the other hand, was seen as desirable, good, and beautiful. The sad part about it was when they asked the students, the black children, which one they recognized to be more closer to them, sadly, they bowed their heads and they said the black doll. This experiment has been done over 70 years and it still shows the same result. So why was I bothered about this? Because I'm in Canada and I saw it in an adult classroom, that there was still that same feeling. So next slide. So because of this, it caused me to be very interested. And as you know, from my accent, I come from England. And when I come from England, next, I'm coming from the mother of colonialism. So what I saw coming from England, so I'll say next, okay? Now, what I saw was that in colonialism, it works because it works with racism. And racism happens because it's the way of making money and making sure that you can thrive as a colonial empire. So racism was very easy for me to see in England. I came to Canada on the pool because I heard Canada had an amazing multiculturalism policy, and it was voted 7 times by the United Nations as the best nation to live in. But when I arrived, I actually saw the same system in nursing that I had left in England. And I was very confused. Why is it that I can't see racism, but I see it lived out in the structure? And then I began to say, okay, let me go back to the university and study this further. And what I began to look at was that, yes, we have a multiculturalism policy and it seems to eclipse racism. So what did I find in my own thesis? I found that there was still this ideal type nurse who was able to really maneuver herself up into leadership. I also found that racialized nurses, and I looked at women from Asia, women from Caribbean and Africa, and also from England that were racialized. But what I found is that they actually found it hard to go up if you were racialized. And I coined it the hybrid space. You had all the education, but to move up was difficult. So next slide. So at this point, I began to wonder what is happening in nursing. So 2020, the death of George Floyd shifted everything for us. Everyone was looking at America, but suddenly we were forced to look at Canada. Nurses women were filming and nurses were saying, words that were very strange to us, that we couldn't believe we would have had these feelings. So one of the deaths we saw was Joyce Echaquan. And when we saw her death, that was around September, 6 months later, Morel also died in hospital, saying, and filmed them, both of them filmed it. And this caused us to bring some things to the surface, that we need to address this issue. Not only were we seeing this, but also it was called out that we had no race-based data. The Wellesley Institute was saying it, Kaite was saying this. Also, Black communities were 3 times more affected by the pandemic. And now public health was saying that racism is a public health problem. So how has racism, this is my question now, several years after I've done my PhD, how has nursing acted, how is racism acting out in nursing? So next slide. So I began to question, working both, just go back one, thank you, working within in the clinical setting and also within the institutions, to look at the education of nursing. And the first thing I found was that in nursing, it is actually built on a colonial framework. And this is backed up by Wittenberg and Vanderberg and Sanders and Crane. They said that our frameworks are still, got that colonial frame in there. Then I looked at the science. I said, okay, we've got science. But when I looked at what Manser and Jackson say, they said that's actually white man property. It still talks to the colonial framework, and the ownership is the male property. And then I thought, okay, social justice, we must come through with that. And so when I looked at that, it became interesting, because under multiculturalism, we use the term a lot, culture. So cultural normativity, culture, cultural competence, culture. And I found that under social justice, which I was seeing, but 2021 says the word inclusivity, which is EDI, actually means that inclusivity really acts as though assimilation. So the dominant class was still allowing you to look like it's all inclusive, but you were actually assimilated. Next slide. So at this point, after the death of George Floyd, I began to talk with my daughter, and I said, I need to look at this structure. So I looked at the care. Nursing, this is the structure of nursing. I've used the Education of Scotland because we're very close to the English structure. So what I've done is use their pillars, and I built on this. And I said, okay, nursing, we pride ourselves in care and safety for clients and for the workers, the healthcare providers. But if I played on the word care, I could change it to create a racism-free environment, because environments are a place we feel safe. So is nursing a safe space? But what I saw was a silencing. So if you look at the 4 pillars, facilitating learning, clinical practices, leadership, and also we look at evidence, research, and development, that all encompass and hold us to sustain us. I asked the question, was nursing a safe space? So the next slide. So I went further and I thought, let me break this down to understand further. So the so if you just do 4 clicks for me. The first, then we stop there. The first one, I said, let's look at the institution. Now we know that what institutional racism is. So we know individually it's overt. Racism is overt, but institutionally it's covert. So I looked at every layer and I thought, okay, where are we in the history? Where are racialized people? We're not actually there. So it's as though we have not contributed. And what Memmi says in his book, Micropolitics, is that if you take away the history of people, you take away their identity. And therefore, they don't feel they belong. So I looked at the others, the hospital community, it will follow through on a pattern that looks more colonial. Next one, just do 4 again. Right, thank you so much. Now I looked at, okay, let's look at faculty and educators. So I educate in the community, in the hospital setting, and I educate in the institution. What was I seeing? The curriculum or the programs that we have still remained a space where there wasn't information talked about race. We talked about culture. We talked about cultural bias, but race wasn't one spoken about. So whenever we produced nurses, they followed a pattern And it was actually what we were seeing, there wasn't any publication. There are publications, but they're on the peripheral. There's nothing really on racism. And although it's there, but it's more peripheral, you have to find it. It's not so much in the curriculum really posted on there. One person that was very interesting was Malone Mukwendi. He's from England. And as a medical student, he said he couldn't find any books or anything to show how the body of a Black person or a racialized person will look if they had a condition. So when we looked at the curriculum, we weren't represented. So then I looked at the third levels, once again thank you so much. It was the students. I could see a breakdown in the relationship now, and I began to ask the questions. What were students asking? So as a nurse, as one working as a professor in the university, I noticed there was a change in the questions asked. And one of the questions they were asking, why don't we talk about racism? Then I found out they were saying in the community or in the hospital settings, why I don't know how to care for racialized people. And then they were saying, you know, I can't see certain places, I'm not seeing leadership, or it's representing a real heterogeneous picture. And Tatum and Lawrence says that if you have a homogeneous group, they produce homogeneous ideas. And now they were asking, where's the publications? Where's the information? Well, we're going to find our own information. And this is why your poll is interesting. Just think about that. So let's go to the next slide. So at this point, I began to look at what Day and Castanga says. The race concept is important for its social and political consequences. To deny the race concept is to deny the lived historical realities of many people. And from this, I began to question, why aren't we within the institution as contributors? Okay, next slide. And this is where it became interesting for me, because I began to ask several questions. If we have no history, then it means we have no identity. And if we have no identity, then do we really belong? Then the next question I asked was, no racial diversity in leadership means no representation. And the third question I asked was, no conversation, and this is what the students were asking me with in the classroom, means racism doesn't exist. And we turned always to culture to explain issues and not deal with racism. So I kind of pictured and said to myself, well, what would it mean if we don't talk about racism? And I said, and if racism does not exist, then no need for change, and no need to keep data, no need to address health disparities among Black populations and unfair treatment of Blacks within the healthcare and judicial system and the childcare system, and no need to talk about the experiences of Black patients and healthcare providers within nursing. And it was for this reason that I felt that we need to have a conversation. And this conversation will now be among the generations, because we need to know what's going on.
Hello, everyone. I'm Leanne. We can go to the next slide. So I'll be speaking about a new lens and the millennial. I thought about what a lens means, and I thought about looking into a camera, and I've often picked up a camera and you're trying to figure out what it is that you're looking at. And sometimes when you look straight into it, it's very blurry. So you're unable to identify exactly what you're trying to target. But the one thing that I've learned is that sometimes there just needs to be an adjustment of the camera in order to see clearly. So what this lens is speaking about, the new lens in the millennial, is taking this lens and looking through a millennial perspective and seeing how that can be used to address anti-Black racism. We'll go to the next slide. So yeah, thank you. When we look at what happened in 2020, we saw a global outcry when it came to the death of George Floyd. And what this showed was approximately 60 countries all over the world, with more than 15 million people who showed up to speak against police brutality and deaths that had taken place against Black people all over the world. And so if we go to the next slide. Thank you. So one of the most shocking protests that took place happened in Germany. And this was really shocking because it was considered to be the second largest after the United States. And what had happened was that so many people came out because they recognized that there was a repeat denial of racial profiling and police brutality that was happening in Germany. And with statistics that weren't representing the experiences of Black people, specifically African people, the country came together and said, we need to make a change. And as a result of this, Germany implemented the Anti-Discrimination Act for the first time. We'll go to the next slide. So a little closer to home, just one more click. Thank you. We saw that there was chaos that took place January of this year. We saw a new movement, a first vice president woman, a first woman who is Black and South Asian. And we saw the first time Capitol Hill being stormed by protesters, or rioters, should I say, who were upset with the results of the election. And so what we're seeing, and Professor Claude Jr. from Princeton University explains it really well when he says, what we saw is an older America clinging to life, and it knows its days are numbered. At the end of the day, I would say, choose your side. There is no in between. And so if we bring this back to the reality that is happening in this new century, this new decade, and with this new generation, we are seeing change happening. And what is being said is, if we do not pick a side, we will be left behind because change is taking place. You can go to the next slide. And so if we were to look through the eyes of a millennial, these are maybe some pictures that we've seen before that look very familiar. If anyone here's name is Karen, we'll keep that between us, but we understand the concept of Karens and Darrens, which we recognize as white people with privilege who have used their privilege to make life harder for racialized people, specifically Black people. And so what we've seen as a result of this is people getting fired from their jobs, a loss of credibility, as well as being exposed on the internet. And this is something that will continue to be carried throughout their life. And so if we go to the next slide, we see from a younger generation, this idea that the millennials and the Gen Z generation are standing up and saying, we are no longer loyal to our families per se, but we are loyal to the cause. And what the cause is equality. What the cause is a chance for everybody to be successful and have a seat at the table. And so if we go to the next slide. And so as I was looking at the events that took place after the death of George Floyd, I realized that there were three things that millennials and the Gen Z generation was looking for. The first thing was, go next. Thank you. We are looking for answers. The second thing is we expect people to be held accountable. And the third thing is we are actually demanding change. And sometimes what this comes across as is rebellion or disrupting the system. But really, if these three things are not addressed, we see this movement happen. We see these protests happen. We see these social media explosions happen because these things are not being addressed within society. We'll go to the next slide. And so I love this picture because it represented the mind of the millennial. And what we have is we have the gathering of Black people, white people, people from every nationality coming together and saying, we have a problem with racism. And I love this because the Karen idea, which says, I'd like to speak to the manager, we have a white sister of ours who's saying, I'd like to speak to the manager of systemic racism. And this is causing us to be accountable for what is happening amongst the Black community. You can go to the next slide. And so when we think about the institutions, the curriculum, the workplaces, schools, and caring professions, when we're told we're being rebellious or we're unable to express how we really feel, we are associating that with silence. And if we click the next one, we see that there are certain words that we associate as silent words, such as inquiring, inclusivity, review, investigate, diversity, equality. These are all words that I'm sure that we've heard, but for millennials, these do not guarantee action to come out as an outcome. And so these just sound like really great words that do not produce action. They sound like great words, but they do not produce anti-discrimination acts. They do not produce policies that are going to protect and advance the Black community. You can go to the next slide. And so just to give a bit of my background before I actually get into the strategy that I created, as mentioned before, I started a nonprofit organization at the age of 12, and at 14, I ended up publishing a self-help book with my sister, and we had put evaluations, personal stories, poetry, anything that we felt was very relevant to help young girls. And we went to the school board and we said, we have something, because we saw that the material 10, 12 years ago on bullying, it really wasn't relatable. And the school board was really excited, but they said, you're going to have to change something in the book. And for us, we were left with the decision, do we change what's in the book to appease what the board wants, or do we keep true to ourselves? And we chose to keep true to ourselves and keep our stories authentic and genuine. So when we speak about this silencing, there's often this idea that if it does not fit a certain scope, then it's not acceptable. We'll go to the next slide. And so what had happened was, in working in the community with young girls, I realized that there was still an increase in suicide, seeing it in the news reports. There was still an increase in mental health disorders amongst young girls and women. And I thought to myself, there has to be something that we can do tangibly to create change and reduce these numbers. So I was introduced to the theory of change. And what this basically is, a step-by-step process that enables you to get to an end result or a certain outcome. We go to the next slide. And so as a result of this, I was able to create something called the Pierre strategy. So the next slide, thank you. So the Pierre strategy is basically a combination of proven methods. So these are methods that we recognize on a daily basis. I'm sure recognize in nursing, even though this is a community approach. We see prevention, engagement, action, and resilience. You can go next. And once again, it's structured within the theory of change that uses an evaluation framework to identify measurable long-term outcomes using a step-by-step process. Next one. And we also identified that we need enriching environments. And the reason why environments is really important is because we wanted to make sure that we were promoting mental wellness. And what we saw with enriching environments was, it wasn't just the programming that needed to be worked on. It had to be the environments that girls could actually thrive and feel safe in these various environments. We'll go to the next one. And so with a lot of research and a lot of studying and reading, I basically took many popular best practices, which were found in bullying prevention, child welfare, mental health, within the theory of change, best practices with juvenile girls, and I lined them up against the type of evaluations. And what I saw was a lot of them had either prevention, engagement, action, and resilience, or they were missing one. And so what I realized is that with prevention, engagement, action, and resilience, it's not to take away from the frameworks that are already there, but my question was, is this a way that we could be more practical in actually addressing certain issues? So we'll go to the next slide. So I'm sure you're asking, what does this have to do with anti-Black racism? Well, what I'm proposing is, with the millennial lens, which we've seen has made change over the course of the last maybe 10 years or so. We've seen that in the Anti-Discrimination Act in Germany. We've seen the numbers go up because of the protests after George Floyd's death. All these things, there's something unique about the millennials that actually brings about change. And so if we were to look at prevention, prevention looks to identify the problem. And in order to identify the problem, we use primary and secondary prevention. And what the CDC states is that with community-based public health efforts that embrace prevention as a priority, we can become a healthier nation. So we know that prevention is looking at the nation as a whole. So if we are able to implement prevention with dealing with anti-Black racism, we're looking at a healthier nation. And by doing so, we're able to address biases and assumptions that may be embedded within the curriculum or within the institution. And as a result, we are able to promote awareness and education. The next one. So engagement is the second step, and engagement is powerful because it enables individuals to be empowered. So when I was working with the young girls, the one thing that I felt was missing was in my own experience, telling my own story. I was told how to tell my story. And a part of empowerment is giving the platform to those who have been oppressed to actually speak up for themselves and be a part of the conversation. And so engagement enables people to be active learners. And when we look at anti-Black racism, we're looking at a place where discussions can happen. Discussions like this that the RNAO is having, which is so useful. We're looking at millennial methods of communication, that these conversations cannot be limited to just the classroom, but we have to see them in the social media platforms, as we saw from the poll, that most people are learning this information from social media. And the last place that we can do this is we can establish relationships in these classrooms, in the homes, and in clinical settings, so that young Black nurses, Black faculty, Black professors, Black patients are being empowered. Next slide, please. And so the third one is action. Action is the most exciting one because this is where change actually takes place. But what I've noticed is that we've often been quick to run to action. We want to take action, but we don't take the steps to get to action. And so action actually addresses the problem. So when we look at action, I've identified two levels. I've identified the individual level and the societal level. And in the individual level, action is identified as agency. And what agency is defined as by Klungman is the ability to make effective choices and to transform those choices into desired outcomes. And why is this important? Because what agency is saying is that Black nurses, Black individuals actually have the innate gifts in them to be leaders, to be practitioners, to do all these things. And what if we address prevention, then we've already addressed certain biases and assumptions that they cannot do it. So by the time we get to action, we are actually giving them the tools to be able to move forward in this way. The second way is societal, because we're looking at advocacy. And like the picture showed before, where we saw our young white sister who said, "I'd like to speak to the manager of systemic racism." Advocacy is basically saying, we will use our privilege to ensure that you are agents of change. And that is important. It's a two-way thing. And this also translates into policies. So we'll go to the next one. Thank you. And even more so, action as being the most important stage, is important to recognize the community aspect within action. And this can be seen in the ABCD approach, which is the asset-based community development approach, which recognizes that the community, the Black community as a whole, has these traits that are able to move forward and be leaders. You can go next. Okay. And so lastly, resilience. This is actually the one that I think is very important. And what it describes is it enables us to reflect and explore how best to bounce back. And when I was working with the girls, I noticed that many things stop to action. This is what you do. You have your programs and that's it. But what I realized is sometimes mental health carries throughout the rest of your life. So what can we instill in a place where we can give to girls that if they aren't attending our programs or if they're not engaged with us, they are able to have the same principles or the same tools to be able to bounce back if an episode did happen. And so resilience was one of the big things that I found. And so what this means in anti-Black racism is millennials and Gen Zs are looking for visible receipts. And I'm sure a lot of millennials understand what these receipts mean. We want paperwork. We want to see evidence. We want to know that what has happened in the action phase is actually measurable. We want to know that the action that has taken place is actually sustainable. And that sustainability is really important because sometimes we can have these conversations and they only last for maybe a couple months, but the sustainability holds us accountable that makes sure that we are continuing this program and this progress to achieve anti-racism and deal with anti-Black racism and racism against racialized people. We'll go to the next slide. Okay, and so this is the strategy that has been created as a result of what has happened within the community with girls and mental health, but this is actually work with nursing. So I just wanted to give you a quick example of when I have actually used this in the field of nursing. In my master's, when I was in Michigan, I used this in a very under-resourced community, and we were able to see how well it worked. And so what we did is the nursing students were given the task to be tutors for individuals in that community, young children. And what we looked at first was how the university had approached it was there's low grades in the community. But when we use the peer strategy, we looked at prevention, and what prevention said is, what is the bigger problem than grades? And what we realized is that the bigger problem was under-resourced schools. We realized that there were unavailable parents. We realized that there was also hunger and low literacy. So by using the Pierre strategy, we're able to look deeper than just the surface problem and see how to address that problem. So when we went to engagement, the department said, okay, we're going to engage with the community and the department. But because engagement in the Pierre strategy enables empowerment, it was paramount that we engage the children in the community and gave them a voice to speak up for the things that they needed. And what we realized is that it wasn't just the children, it was the parents we had to engage. And as a result of this, we realized that a lot of the feedback was that the children were hungry. And for this reason, we could not just have a math program. We had to provide meals. We had to provide math games to help the different types of learning of the students who were attending. The third step that we took was action, and this was the actual math program. But we went beyond that because action was at an individual level and a societal level. And what we did at the individual level was that we trained older students who were coming to the tutoring program to be the tutors. We didn't leave it up to the nurses to do the tutoring. We gave it to the younger students or the older students, and they actually became the tutors of their siblings and other young children in the community. And as a result of this, there was much more interest from parents to get their GED or go back to school. And so these students, these young 14, 15-year-olds became the tutors, not just for their younger siblings, but also for their parents. And this was transformational. And the last thing was resilience. And so what we realized is after the pandemic happened and we no longer had access to the community, we realized that we had given them the tools to continue this training program even without us. So we'll go to the next slide. And so this brings me to what we call cancel culture. So I know before my mom was speaking about, cultural sensitivity, cultural competence, and all these different kind of cultures. But the unfortunate thing is that we have come to a point where millennials and the Generation Z are fed up with having these conversations or not having conversations that are feeling like we are being silenced. And therefore we've created our own culture that we call cancel culture. And the danger of this cancel culture is that it affects people in many different ways. We look at it affecting people financially. We will no longer support your business and you can run out of business. We've seen that happen. We will cancel you physically, which means that we will not show up to your classes. We will cancel you socially, which means that we will expose you on social media, and we will cancel you emotionally, which means that we won't even engage in a conversation if we feel that you do not know. And this is not a healthy place to be, but what I believe we can do before we get to the place that we are canceling and there's no more conversations to have is we can implement something that engages and involves the millennial perspective, which is looking for change. With the history and the context of the older generation and with the passion to make changes from the younger generation, we are looking at a way to actually deal with anti-Black racism, and the Pierre strategy is one of the ways that I'm proposing we address it.
Yeah, thank you. So can we go to the next slide? So one of the things we began to do, Leanne and myself, is to say, okay, care is like the structure and Pierre is like the lens that has a problem-solving approach, and it's like the function. And so what I found was that when we began to discuss it is that if we look at facilitating learning, there is a need to have these conversations. We are not negating what has been done already, but we are saying we're at a cusp of a change that we now need to be aware to add new things that will help. And so the first thing was we need to have mandatory modules. We need to start to talk, have these conversations in class. We need to train faculty, educators, nurses, and also students that we can answer their questions. In the clinical setting, we need to have ongoing training and services within the workplace because we want to build a healthy environment. That's why we call it create a racism-free environment. We also want to look at policies that they are not homogeneous, but they are heterogeneous. They are representing Canada's multicultural framework, or the way that Canada looks. And we said also, we need to put money towards specialized programs, specialized scholarships, and also funding and publications that speak to what Canada says, and also evaluate. Next slide, please. So this will create an intergenerational discussion. And I'll ask Jen to continue.
And so infusing the Pierre strategy with nursing and what nursing can do to address this issue of anti-Black racism and racism in general, we look at prevention, which is once again to promote education and awareness. And this can be done by, next one, please. Thank you. Early intervention.
Okay, just do them all. Sorry, Anne-Marie, just do all of them.
Okay,
Thanks.
that's good. Thank you. E-learning and assessments. We look at the second part, which looks at engagement, and this happens within the clinical settings where we're able to train staff and clinical instructors to create champions and advocates and trainers and give them voice and empowerment to Black nurses, professors, and faculty. We'll go to the next one. Okay, we're able to take action, and this looks like on the level of leadership and policies, and this is establishing leadership positions, which gives agency to Black nurses so that we can deal with this hybrid space where you don't have the ideal nurse, but you have an equal representation of Black people in these positions, as well as support and promote leadership by our fellow white brothers and sisters through the use of advocacy. And lastly, we will use resilience through evidence, research, and development as a way to encourage innovative research, development, and publications, but this will also be an evaluation to assess if change has actually happened. And if change has not happened in this way, then we would have to go back to prevention.
Okay, so next slide, thank you. So in concluding, just before the next one, thank you. We're really looking at three things that we feel that are important. The first is there is a need for intergenerational conversation. One writer says that my generation has the history and the understanding, but for my daughter's generation, the Millennial and the Gen Z, they have the passion. We want to bring these two together. And so by having this conversation, my generation can realize teachable moments that we can help. And at the same time, we can work in partnership. The other thing we want to do is to reintroduce care to the profession of nursing. So it now is not just care and safety, as we often look at it, that only some groups benefit, but it's now also providing creates a racism-free environment that all can benefit from it.
Okay, and lastly, we want to look at new approaches that involve the millennial voice, which we know are crucial to bringing about change. So identifying that it is the powers within the millennial to make the change is what it's going to take to really address this issue of racism. And the last slide. Thank you. And so Martin Luther King Jr. says something that's very profound that we think summarizes everything. There comes a time when one must take a position that is neither safe, nor politic, nor popular, but we must take it because our conscience tells us it is right. And this is why we are here. We are here to do the right thing, and we hope that you will be a part of this journey with us in order for us to deal with this issue.
Thank you. Thank you.
So,
Go ahead, Doris.
just a brief comment. Liana and Nadia, not only we are part of your journey, we started the journey in addition to your piece. The work that Areneo has been doing, and you know, as much as tragic as it sounds, I think that Javier didn't have the opportunity to share that in her remarks. This whole thing started thanks to the tragedy of George Floyd. I mean, yes, Areneo had done position statements. Yes, Areneo had spoken on anti-racism, but to your point, the VPG that had been developed was about cultural diversity. And I remember feeling uncomfortable about that, but not knowing why. Like, you really helped me understand why at the time I felt uncomfortable that we were calling it cultural diversity versus racism, which is, you know, what it was to me in a naked and uninformed eye, but in my heart. And when we invited, I think, Nadia, you were in the first meeting, I think, when we invited the nursing community to join to talk about George Floyd, was nothing to do with nursing. That first meeting was what can we do? Because we felt that we couldn't breathe. We felt And then we started to hear about what nurses started to share about their own. Not that we didn't know, but we didn't know the extent. Honestly, I have been 25 years at RNO. We did not know the extent of suffering. I was, before your time, director of nursing at Sinai. We spoke a lot and did a lot of things. But honestly, until that meeting, Nadia, you know, when you hear one here and one there and one here and one there versus what happened in that meeting, that was overwhelmingly devastating. Overwhelmingly devastating for us, the white nurses, to hear the level, the intensity of the suffering and injustice. So this is not going away, guys. And you got to be part of this journey with us and help us, because it's not going away. We are going to tackle it because, and Angela will know this, and Corsita too. We have received all kinds of, can we bring a presentation about this and about that and about the other? And if it's not about nursing and looking at the mirror, we say no, because it's very easy to look at the rest of the world and not clean up our own mess, right? It's very easy to then say, oh, we tackle this, we tackle that, but not look at the mirror, what's our mess. So we got to stick with it until we, and I love what you spoke, Leanne, about the culture of counseling. Until you spoke about that the other day, I never, it's fantastic. What a way of standing with your voice. You know what I mean? If you're not going to account for us, we're going to cancel you. It's just brilliant, brilliant, brilliant.
Thank you. Thank you so much.
Thank you.
Thank you.
So Nadia,
Yes.
Leanne, I want to thank you for your creative, innovative, transformative, engaging presentation. And I could add many more qualifiers to it. It was just fantastic. And as the philosopher would say, par excellence.
Thank you so much.
And I know it opens the door for people to think and see how they could be part of this transformative process that you have described, and how we could engage it and move the society further, because things have to change. So now I have a few questions for you, and then I will open it up for discussion, okay? So one of it, and I know Leanne did share, how have you used Pierre in your work in the community? And I know she described that.
Yeah, so I did give an example earlier, but another way that we've used it, we actually, under the organization that I run, we use it in every single one of our programs. And we make sure that the girls that are coming in, we're actually able to assess and see if our program was impactful, if it created any kind of change. So Pierre really has actually worked as a framework in my entire life. When I have any problem, I think, okay, what is Pierre? What is the problem? How do I engage? Who do I need to engage? What action do I need to take? And how do I ensure that the action was the right way? So it's been used in many ways, and I hope to do some kind of research in that area to see if it's something that can be beneficial to society.
Thank you. My next question could be your mother's question. What strategies do you use to understand anti-Black racism within the nursing classroom that is inclusive of all people?
Yeah, okay, thanks very much. So I've used the peer strategy without people knowing. So for instance, I give an example of working with, one of the classes I teach is the rights of the child. And I remember one day teaching it, we had a social worker that came, and one student was talking, mentioned the word anti-Black racism, and another student, and it wasn't, I don't believe it was deliberate, but didn't want to talk about it. That is a teachable moment. So what I did was to make sure that my assignments will let them start to talk about this topic. By the end, I looked at the problem, which is that some didn't want to talk about it, some did. I wanted to engage, so I put activities in there that they would be engaging with the topic, that it would be a teachable moment. The action I took is that they would have to do a presentation. They did the presentation. The end was the resilience. This is what came at the end. I didn't know. Why aren't we talking about racism? How do we deal with racism? Because they were using words like cultural bias, cultural sensitivity, but they were not using the word racism, which is the elephant in the room. By the end, they bounced back and said, we want to know more. So I use it all the time in my activities. I give them spaces where they can talk about it. And I use a lot of illustrations that they don't feel threatened by it, but they feel that they want to explore more. So I'm constantly doing it.
Thank you. And my third question is, and it's the final one, what barriers have you experienced as a millennium when talking about anti-Black racism among your peers? And that could be either you or your daughter.
Okay.
Either you or Leanne. Please don't call her daughter. She's herself. Guys.
Thank you.
Sorry.
I'm glad that they're mother and daughter, but the woman is
but
such a
you know,
leader.
yeah. But she's always my baby, even if she doesn't like it.
Now, what happened with the other? Why is Lawrence, your sister, not here? If we may know.
Yeah, well, her work is more entrepreneurial, so I kind of took up the organization and ran with it since then. So.
And she still does a lot of work with it. She's more a hands-on person.
I think you guys need to write a book.
Okay.
No. I mean a book about a mother and two daughters. Like how you have, because that does come from you, Nadia, in terms of upbringing, right? But my gosh, she will surpass you at some point. And that's awesome. Isn't that what
Well, we do quite a lot of work with mother and daughter's relationship, and we actually have a lot of discussions that we can break down these barriers.
Wow.
And that's why we brought it into the nursing field. Thank you.
So I'll just answer the question quickly. I think that some of the barriers that we face, I think because of George Floyd's death, racism is a more open conversation, which I'm very grateful for. But I think sometimes in certain spaces, it does make people uncomfortable. So that is why having these conversations where we can say the word racism, we can say what the issues are so that we can move forward and actually address the issue is important.
And I'm just going to add on to Leanne. I know it's not for me, I'm not a millennial, but the point is very important, because what I found is that and that's what what we did, the poll showed us, is that people are getting information from social media and media. So what I try to use in the class is that I want them to look at the critical papers and everything, but I also have to realize they have another platform that they're getting information from. So Leanne and I often work with what is out there, what are they hearing? How can we navigate the discussion that they will actually look at critical research, critical papers, because it is happening. They are using another platform and we're left behind. So when we're in the classroom, it's a barrier. We don't know how to talk to them on the topic. So we see them as being difficult. They're just using another platform. We need to understand their platform and how we can actually
get into their platform. Darling, both of you are not on Twitter. I already checked it out. Both of you are not on Twitter.
Yeah, we're not on Twitter, but we're on other things.
I know, but Twitter convinces politicians and the media. You got to get on.
We use other things. We know what's going on.
Okay, thank you so much. And now I'll ask Javier to facilitate the discussion from the audience, and I'll pass it on to her.
Thank you so much. Thanks so much, Nadia and Leanne, for that truly incredible discussion and presentation. So we will now open the floor for participants to speak, ask questions, engage with our panelists. You can do that through the chat box or raise your hand.
Meanwhile that you get the hands, is Madison still there? I would love for us a picture, everybody, and then tweet with the book in the middle. I think this is a book to be promoted.
I see that Heather has her hand. We'll allow her to talk.
You can buy the book in Amazon. I am seeing some questions. It's in Amazon, and I put it on the chat, guys. I put on the chat the link. I can put it again. It's a fabulous book.
Yeah, and just to remind people, when it happened, which is an interesting background to it, I have had no involvement in it at all. So it is written from their view. And it was because my daughters were, as immigrants, new people coming to Canada, were experiencing bullying. I was working several jobs at the time, and I realized what it was doing to them. And the only way I could help them was to say, just write down. I never touched it or anything. So it is written from their view. From a 12-year-old view, a 12-year-old view. And they worked on it themselves just to get them through the bullying.
Okay, I see Hagar has their hand up. If they have any questions, I've unmuted you so you can ask. No.
I think there's just one that says, there are so many books written on racism and surprise most people get their information from social media. Can you comment on this further?
Okay, sorry, there's so many books. Yeah, the difficulty we have is that if a space is not providing materials, people will go and find other spaces. So what I found is that I guess I had the fortunate part is because my research was on race, but at the time, nobody wanted to talk race in nursing. So I had ideas of other people who were outside of nursing, lots of classical people, Fanon, other names, Membi, that were talking about it. So what I would say is that there are many things. Let's start to look at what's happening in nursing. Let's start to create our own platform of information to speak to it. I'm hoping that answers your question, because I know people get lost with all the different things. So we need to have class and training where we can point you to the critical information, critical papers that will help and speak to nursing.
Mm-hmm.
I've got another question here. Racism often, oh, sorry, was someone saying something?
Oh, go ahead.
Okay, sorry, yeah. Racism often occurs between the nurse and patient on my unit. How can this issue be addressed more effectively instead of having that nurse not have that patient on his or her patient assignment next shift? Very good question. This is a very good example of how racism is covered. Now, what happens is that what we do, we try to put a Band-Aid on and not understand the trauma it causes the nurse. And that is not fair. Patients should not be allowed to be abusive in any way, because racism is not only abusive, it kills. It causes trauma, and we have to keep working through this trauma. So every time you move the nurse, you're telling her she is the problem. And that's a bad information to give her. So it is the responsibility for leadership to understand how racism works. It works in multiple ways. And so nurses should feel, and that's why we go for, create a racism-free space, environment. Nurses need to be trained that, we need to deal with this. We will not accept any forms of racism. So we're looking at microaggression, we're looking at bullying, harassment. They're all ways, avenues that racism plays in. So when it comes to that, to the person who asked, leadership needs to go into training and know that they should not be moving you into another shift, because you are traumatized. The patient continues the act, and their children, just like the man that I was teaching, he will continue it because he'll train his children. It has to stop.
And Nadia, if I can add to that, going back to my time at Sinai, frankly, HR needs to be trained. HR needs to be
yes, definitely.
That when there is a complaint in a unit about a nurse and the manager goes to talk with the HR, you know, they need to be trained. Same as in the college with discipline, because if not, you're totally right. What they do is they remove the nurse from that patient. Let's not give aggravation. Let's not give aggravation about the patient, so the patient will not complain. Meanwhile, the nurse is going with the head down more and more and more.
Yes, yeah.
I think just to add, I know somebody had commented after, and they had said that racism happens from leadership as well, and sometimes the best thing to do is to remove the nurse. And every situation is very unique and different, but I think what we're saying is that if the problem of racism within the environment and the institution remains, then we are actually not fixing the problem by removing the nurse. And so as Doris has said, we have to look at training with HR. We have to look at training in leadership to actually address the problem that nurses should not be moved. because a patient is being racist towards them. And so therefore there has to be boundaries and barriers and consequences even for patients if they are participating in racist acts.
Just to add to that point is that one of the things that Leanne and myself are working on is how when people don't do anything, this silence, what is this silence? And sometimes people don't know what to do because they don't want to connect. Sometimes they don't know what to do because they have a fear. And I feel that there's a need for these trainings to be in place, that they identify their reasons. So you may have a manager that says, okay, let's just leave it. It might be that they just don't care. I just don't want any problems. Another one might say, I don't know what to do. So as we begin to identify, we begin to give solutions on how to address it. And that's why the peer is really good. Why aren't we addressing it? There's a problem. Have you engaged with why you feel that you can't address it? Or is it that you just don't want to address this? Then we're going to have another big problem. And this is why we have to really keep it real, that people are actually suffering with it, and it will continue because the framework is actually colonial. And that's why we need new lens to really say, okay, let's shine on this. This isn't right.
Like to add, in the 1990s, we implement those code whites when patients and physicians were abusive to nurses or other ones. Just as we implement those code whites, we need to implement zero tolerance of abuse, whether it be from patient to staff, staff to staff, leaders to staff, and leaders must be held accountable for the institutions that they lead. And they should be the first ones starting to take the education so that they can pass it down, not just in policies. Policies are not enough. We need to educate ourselves how we would address racism.
Let's do in the recommendations. Let's call it Code Black. And when a nurse or a doctor or a whoever is experiencing racism, we call Code Black.
Doris, you can't call it Code Black because Code Black is going to bounce.
Negative.
If
then call it Code whatever. Find that the Black community will.
Everyone might take a run.
But it wouldn't be a bad idea to call it something that we gather when someone is suffering discrimination.
I agree. Completely. I think the other thing we have to realize, and just going from Leanne's work and understanding
here you go.
Cancel culture.
We have Code White.
That's Code White already.
We have Code White already, Doris.
Yeah.
I know.
Call it Code Violet.
Someone wrote Code White.
So go to action,
Code
right?
Violet. A different color.
Code B. Code B.
George Floyd.
I wonder if I could ask a question that Amanda has had in the chat box. And she says, I heard a recent speaker say that the burden on her back of anti-Black racism towards her won't disappear as a Black woman. But as non-Black people, we can help carry that load to make it lighter. And she says this has resonated with me because I guess it felt very visual, but also felt actionable. It's a question I'm asking myself. How can I help carry some of this?
Okay, I did this class, I did a session, I think it was me who said it, the person's asking, because I mentioned it on Friday in one of our sessions. What I try to explain is that it comes from, and this is why we use Martin Luther King, because he is about bringing people together. And so we're looking to make this space where we can work together. He talks about the whites, there's a shame that whites feel, there's a burden that Blacks carry. We need you to help us, but we need, and that's why Leanne's work is interesting because she talks about agency. We have the ability, but you have the advocacy or the privilege. So how do we work together? We have to all go into training. We have to train educators. We have to train nurses. We all have to have a specialized training, and it's not a training by which the danger is the cancel culture. It's coming, it's here. If we don't come in to have conversations, the next generation will cancel you. Your own children, white children will cancel their parents. That's how serious it is. Because there's a cause that we're working towards. So what we need to do is to understand the history, what's happening, the lived experience of how it's impacted us. We talk about epigenetics. We talk about people passing things down, trauma down. Now we have to work from a place to say, let's get there. Let's understand what was happening. How do we work together in now bringing this healing? So all of us have to go in. And that's even also different racialized groups as well, because everyone is carrying this.
Discussion is very vibrant, but we are running out of time.
Sorry, yes.
Well, I think we need another session on this. I think this is
yes, we do.
fantastic.
But I'll let Javier bring her closing remarks, because I have another meeting starting at 4.
Yes.
Very interesting, innovative, informative, great learning experience. So I'll pass it on to Javier.
Yes, thank you. And sorry to the participants that we're not able to get to, but we can share and pass on your questions maybe to our panelists. So we'll now, unfortunately, since we've run out of time, we're going to just provide some information regarding upcoming events. And so we'll go through that now.
Okay, I'll just like to say that on another note, we have a COVID-19 event webinar that is coming up soon in June. Please look out for the details on the topic that's coming. I'll also like to tell you that our 96th annual general meeting is coming up in June, from June the 24th to the 26th. And prior to that, we would have the nurses who are running for president-elect. There is going to be 2 webinars for them. Look for the date as well as the regional representative to hear them speak. It would be an opportunity for RNU members to speak to them, to ask their questions, because you will have to vote. 1 member, 1 vote will determine who becomes the next president of RNU, and you have the opportunity to ask questions of the people who are running for the president-elect. So this is a time to be better informed, to become knowledgeable of who you would like to represent you in the future. And also, I like to say our next webinar series will be in July 2021. Please stay in tune for further details, and we hope you join us. So thank you for being part of this evening's presentation, this afternoon presentation. We extend our warmest gratitude to our speakers for the excellent, informative contributions to the panel discussion this evening. Afternoon.
Thank you so much.
Stay safe. If you haven't gotten your vaccine yet, go get one. Bye for now.
Bye. And thank you. That was excellent.
Thank you so much. Fantastic presentation.
Yeah. And all the comments.
Muy fantástico. I have to leave. Bye.
And good questions people had also.
Yeah.